An immense amount of research is happening behind the scenes to help Canadians better understand COVID-19. Doctors are working around the clock to answer questions like how the virus spread, why some people fall ill and others barely feel symptoms at all, and whether or not there is immunity after infection. We have the latest findings from across the country.
But what we really want to know is how the virus is moving around the province, within cities, among provinces, and as we open up the border across nations.
Invaluable information that will help control the severity of an inevitable second wave. Researchers are using the nasal swabs from patients that have tested positive to get the full genetic code of the virus and determine how COVID-19 spread across Canada.
That genetic code has over 28,000 data points in it. So that instead of just saying yes, no, and now I have 28,000 questions I can ask about that virus.
It is complex science that didn't exist during the SARS outbreak, but it will be important in helping to identify which public health measures worked this time around and which ones didn't.
So a really good example is if we start to get cases in the north. We've had very few cases in the north, but if that goes up, we could use the sequence of the virus to ask, is this, a strictly a northern problem that people are cross-infecting? Or is this southern Ontario folks going up to the cabin and infecting these communities? All those have different infection control responses, so we need that level of information.
Based on the research they've done so far, they've hypothesized that travel during March break before borders closed sparked the spread in Ontario.
How is this going to help us prevent the severity of a second wave?
We want to be able to respond fast because we're going to find as we open up things that don't work and that outbreaks happen. And so we need this level sort of detective work to figure out why did it fail so we can make changes so it doesn't happen a second time.
At the same time, antibody testing is up and running in Canada. The country's immunity task force is determining how many people unknowingly had COVID-19 to give Canadians a better idea of the infection rate and whether or not those who have had it are immune.
Certainly the early research, I would say, is suggesting that there is some immunity.
Researchers are using leftover blood samples from donations to Canada Blood Services and blood samples taken from routine testing, for instance, pregnant women during prenatal tests. It's all done anonymously.
It's a really fast way of getting some data out there.
But antibody testing is not available to the general public yet.
We're not there yet. The value of the information for an individual, as much as everyone would like to know, have I seroconverted or not, we don't actually have information about what that means for that individual. Are they protected? And so we don't want people to have a false sense of security.
The federal government has invested $40 million into the effort of collecting and studying nasal swabs, $20 million to sequence the virus and determine how it is spreading, and another $20 million to sequence patients and determine whether or not genetics plays a role in how the virus presents itself. For City News, I'm Yazdani.